Okay, so this is the second part of our lecture on cranial nerve testing. In the first session, we have discussed the cranial nerves 1, 2, 3, 4, and 6. So that's the olfactory, optic, and the nerves that govern your intra and extraocular muscles. Now, this time we're going to talk about cranial nerves 5, 7, 8, 9, 10, 11, 12. So the rest. Okay, so let's begin. Okay, now let's talk about cranial nerves 5 and 7 first, because basically they are sort of mirror images to one another. Now, when it comes to the face, remember, when you're talking about cranial nerve 5, you're talking about mainly sensory of the face, sensory function of the face. Cranial nerve 5 and 7 are both mixed nerves. Cranial nerve 5 has two major branches. The larger one is sensory. Contrast that with your cranial nerve 7, your facial. Your facial nerve, when you talk about the face and cranial nerve 7 facial, you're talking about the motor function of your face. Okay, so let's go to cranial nerve 5. When it comes to the face, cranial nerve 5 is all about your sensory function, sensation all over your face, whether that would be pain, light touch, um, thermal sensations, fine vibratory sensations, cranial nerve 5. Okay, and it has three branches, distinct branches. Now, the first one would be this. Okay, that's your ophthalmic division of your cranial nerve 5. Next would be your, okay, this part, including the upper lip. This is your maxillary division. And then lastly, this part, your jaw and your lower lip, that's your mandibular. Okay. Now, so it's not so hard to remember. Okay. Just remember a medieval helmet. Okay. So that's your the divisions there. Now, of course, if you look at the head from the side, okay, your cranial nerve 5 is basically this part here. Okay, that's the ophthalmic, maxillary, and mandibular. Okay, remember, your ear does not belong to cranial nerve 5. Sensations around your external ear is cranial nerve 7. Okay, now let's go. So basically, that's your cranial nerve 5 sensory function, sensations of the face. Um, what else? How about your motor function? Your motor function is just minor. Well, if you think chewing is minor. So your major muscles for mastication, okay, your temporalis, your masseter, your lateral pterygoids, those are your muscles of mastication. So when you're checking for the motor function of cranial nerve 5, check the temporalis and masseter here, okay, the muscles here. You can let the patient clench the jaw there, and your lateral pterygoids, the function of that is jaw protrusion, like this. Okay, you protrude the jaw forward. So just remember this, the pterygoids basically push your jaw forward. Okay, so if, let's say, the left pterygoid is weak, only the right can push. So basically your jaw will move like this. Okay? Normally, when your lateral pterygoids push, your jaw moves forward. If one of your pterygoids is weak, it will do that or it will do that, depending on which is weak. What's nice is that your jaw will point to the weak side. Okay, that's your clue. So if your right side is weak, the jaw does this. So it basically points to your weak side. Remember that. Now, let's go to your facial nerve. Now, your facial nerve is motor function of your face. So just remember this, all the openings in your face, that's cranial nerve. Oh, the cranial nerve 7, the facial nerve, controls the muscles around that opening. For example, eyes, okay, nostrils, mouth, ear. Well, of course, your ear doesn't close voluntarily, but some people could move their external ear. They have an accessory muscle there. It's facial also. Now, so the muscles around the eyes, okay? Remember, cranial nerve 7, the hook that closes your eyes, right? Um, your muscles around your nares, nostrils, and your muscles also around here, okay? And you have your muscles around your mouth. Another thing, your tongue. Basically, your tongue is the sensory function of your cranial nerve 7, especially your anterior two-thirds of your tongue. So the sensation, meaning the taste, the touch sensation of your tongue, the anterior two-thirds of that is the sensory, um, is innervated by your sensory component of your facial nerve. Okay? How about the motor component of your tongue? We'll talk about that at the very last because that is cranial nerve 12. Okay? Another thing that you should remember is your ear. Sensory around your external ear, that's your facial nerve. Also, remember your ear, it has your, remember your small muscles inside your middle ear, your incus, malleus, and your stapes. There's actually a muscle that holds your stapes, okay, so that it won't really contact with your eardrum. If you saw lightning, you are expecting the thunder afterwards. Many an occasion, your facial nerve, basically the muscle that it innervates in your middle ear, it sort of pulls your stapes away from the eardrum, so that when the thunder strikes and it's very loud, you won't hear it as loud. Okay, so your facial nerve basically preps you for loud sounds. So if your muscle here or your facial nerve is gone, is weak, your stapes is always in there, and you will basically have a problem called hyperacusis. So the problem there is excessive. I mean, you hear things more acutely, like mga marites. Okay. Next, um, so we are going to talk about your muscles in the face. Okay. So forehead, when you wrinkle your forehead and your eyebrows, okay, that's your facial nerve. Look at this. The lips also protrude, again, facial nerve. Oh, look at your nostrils there. It flares, and you have wrinkling of your nose. Okay, you have your lips, the edges of your lips are drawn out. How about this? your eyebrows, and your eyeball. Your eyebrows, facial nerve. How about your eyelids opening up? Is that facial nerve? What's our clue there? Eyes. And then picture a pillar holding the eyelids open. Cranial nerve 3. And lastly, there you have your pursed lips. Okay. So those are all facial nerve. So all you have to do when you're checking for facial nerve, tell the patient, wrinkle the eyebrow, wrinkle your forehead, wrinkle your nose, or kung kabalo siya magpahungag, okay? Purse your lips, okay? Or draw them into a sardonic grin, like that, okay? Your, especially for not so young people, you could take note of the creases, okay? If there is a crease and you on one side of the face and you compare that with the other side of the face, usually if you don't have as much creases as on the other side, chances are the one that has not very many creases is the one that is paralyzed. Okay, that's why if you have many wrinkles, you give Botox to paralyze the muscle. Okay, so if you're sick and tired of your wrinkly old face, you cut off your facial nerve there. Okay, so I'll just show you. These are patients with Bell's palsy. Now look at this. Look at the edge of your mouth. Okay, which one do you think is weak? Remember, the one that is stronger predominates. So this side is stronger. It pulls this the side there. Okay, so just let the patient follow your face. If you do that, they follow, and if they have a different um, contour there, then that's the problem. Okay, also look at the eyelid. See this eyelid here? Okay, basically this is more open than this. This is a bit more closed. Do you know what closes your eyelid? Again, it's a hook, cranial nerve 7. So if your hook is not so strong, what predominates? Cranial nerve 3, the one that opens. Again, let's look at the middle picture. What do you see here? Look, the nose is deviated to this side. The mouth is deviated to this side. You have more wrinkles here. See? Around the nose, around the mouth. So you have a smoother side of the face here. So basically this side is weak. Okay, and look at this. Look at the size of the eyes. The eyelids is a bit more closed. This one is a bit more open. Okay, classic Bell's or facial nerve palsy. Now let's look at the last. Again, look, mouth deviated to one side. You have creases, more creases on this side. Your nose is drawn to this side. You have more wrinkles here. Okay, you have an elevated eyebrow here. This one is not so much. The eyes is a bit bigger here. So this side is weak. Okay, so those are the things that you need to look with facial nerve. Also, one more phrase that you should remember when we're talking about the cranial nerve, number 7, facial nerve. They say that the facial nerve cries when sad, and the facial nerve spits when angry. What does that mean? Your cranial nerve 7 is also responsible for lacrimation, tearing. So usually if a patient complains of eye pain, eye redness, you check, it might be that the eye is a bit drier. And why is that? Number one, problem with tearing. or sometimes there's excessive tearing. But but the thing that you can also check is there might be excessive tears because the eyelids could not really close. The cornea dries up so that there's more tears coming out. Okay, so lacrimation, facial nerve. Also, how about spitting? Your salivary glands. How many salivary glands do you have? You have a really big one here, parotid. You have your submandibular, sublingual. You have a lot of salivary glands there. So it's also facial nerve. Okay, so that's it. Remember those things. Okay, let's go to your cranial nerve number 8. So it's called your vestibulocochlear. It's a pure sensory nerve, but it is two nerves rolled into one. You have your vestibulo, okay? Basically, when you are talking about the vestibular component, you're talking about balance, okay? You're talking about balance. And your cochlear, you're talking about hearing, okay? Balance and hearing. That is why your ear is not only for hearing, it's also it also has a very critical organ for um, balance. Now look at this. This is a very nice photo. This is your external ear. No, this is your external ear canal. This is your eardrum here, and this is your middle ear. And this is your inner ear. Now, if you look at it, your inner ear looks like a snail, and it has a head. Basically, you have two parts. You have your semicircular canals, okay, 3, and basically they're like gyroscopes. And then you have the snail-like here that is basically has hair that detects vibrations due to sound. Semicircular canals detect vibration due to movement. Okay, so they measure two different things. I do not know if you've experienced vertigo. Okay, when you say vertigo, it's not just plain feeling faint or feeling dizzy. When you're talking about vertigo, you feel as if the floor is floating like that, and it's a really bad um, problem. And sometimes you experience vertigo when you suddenly twist your head. Sometimes things roll and you have to sit down and um, rest for a bit. Now, here are your inner middle ear bones, incus, malleus, and stapes. Basically, your facial nerve has a muscle here that holds the stapes, so it won't really. Oh, sorry, this one, stapes and your eardrum. Anyway, so that's your vestibulocochlear nerve. How do you test it? You have to test it one component at a time. Choose one. If you're going to choose the vestibular component first, you have to check for balance. One very good test is your Romberg test, where you're looking for a Romberg sign. Now, if you stand straight, you can maintain your position. Even if you stand on one leg, you usually don't have any problems, especially with your eyes open. Why? Your eyes check the horizon. Okay? It checks the horizon and it helps with your balance. But once you close your eyes, okay, you no longer have the input from your eyes, so you cannot see the horizon. Now, more than ever, you need your vestibular apparatus in your middle ear. You need it. You need your cerebellum and your other important tracts there. So, if your patient could stand up straight with their eyes open, but once they close their eyes, once you blindfold them, they became more unsteady, that is a positive sign, meaning there is a problem with balance. Now you have to check, where's the problem? Is it with the spinal tracts? Is it the cerebellum? Is it the vestibular apparatus in the middle ear? Okay. Now, there are vestibular tests where you try to suddenly, okay, or stimulate your vestibular apparatus, because those who have problems with the middle ear or inner ear, their semicircular canals are so sensitive that when you just turn their head, everything, is seems topsy-turvy already. So you basically provoke that sensation. It's not a very good sensation. So you have to warn the patient. So that's your vestibular test. Next would be your hearing test. Now, you would hear about the Rhine and you would hear about the Weber. Okay. So one test, okay, one test is the Rhine test is basically you're testing for conduction. Okay. Is the ear, is the hearing apparatus receiving sound? And basically sound is just vibration. So basically sound can enter to our ears two ways. One is by air. Okay, so basically just look at your earbuds. If you have an earbud, okay, you put it in your ear, or you just have a headset. So that's air conduction. It flows through your through ear canal, and it makes your eardrum vibrate. That's your air conduction. Okay. Another gadget is you have your right now you have Bluetooth bone conduction headsets. So basically you don't put it in your ear, you just put it over here or here, just in front. Okay, so they don't need to vibrate the air. All they have to do is vibrate the bone, and the bone, because it's solid, it vibrates. The vibrations reach your middle ear via your bone. So there are people that cannot hear sounds brought about by air. And what's mainly the problem? You might just have earwax. Okay, so you cannot hear air sounds brought about by air because your ear canal is stopped, but you can hear when it's bone, because even if it's bone, I mean the vibrations will get transmitted. Okay, so you have a tuning fork, put it here first. Okay, so if you can hear it, air conduction's good. You put it in your mastoid. If you can still hear it, it's also good. Okay, if you have a headset, okay, or bone conduction headsets, that's basically what you're doing. Okay, now your Weber test is a test for localization. You basically put it in the middle and ask the patient how they are perceiving it. Are they hearing it equally on both ears? Okay, so you basically it's a more general test. Just check if both ears are healing fine, and you can test individual ears with air and bone conduction. So that's it. Now, I'll just go back here first, and I just want to show you this. This is your auditory tube. Do you know where this leads? Your mouth. So sometimes if you have a lot of phlegm, you're coughing, you're sneezing, your phlegm might reach your middle ear and have an infection there. So sometimes when you have a cold, you not only can you not smell, you cannot also taste, and sometimes you cannot hear very well because of a blocked auditory tube. Okay, so now let's go to your cranial nerve 9 and 10. lumping them all together because you basically test them together. Okay, so number 9 is your glossopharyngeal, number 10 is your vagus. Now your glossopharyngeal, from the name itself, glosso, tongue. Remember your facial nerve anterior to the head at the time. So if that's your anterior 2/3, your glossopharyngeal basically innervates the sensation of 1/3, posterior 1/3 of the tongue. So somewhere here. So the sensations, the taste, okay, pain or whatever else, temperature in the posterior 1/3 of the tongue, that's glossopharyngeal nerve. So just with the name itself, glosso, and then pharynx. Okay, so and then you have your vagus. Okay, now your vagus is also called your wandering nerve because just look at this. Well, the screen covers, but this is your vagus nerves. Look at this. It has fibers innervating your pharynx, your larynx. Okay, so when you have laryngeal problem, that's basically your vagus. It reaches down even to your heart, okay, to your stomach, to your intestines, so all the way there. So that's why it's called the wandering nerve. Not only is it around here, it even reaches up to your gut. You may have seen people who have very high blood pressures. Some would be um, massaging their neck like so. Why are they doing that? Because you have carotid sensors here, where if you massage them, you're basically invoking the vasovagal reflex. That's one stimulus for your vasovagal reflex. You stimulate your vagus nerve. Your vagus nerve basically lowers your heart rate. And, well, hopefully it lowers your blood pressure. For some people, if you already have a low enough blood pressure, and sometimes if you stimulate your vasovagal response, you will have a critically low blood pressure and you might faint. So be careful with that. Okay, let's go to swallowing. Okay, now look at this. Your swallowing is a very, very complicated reflex. It's called a reflex because once you start it, there is a cascade of responses there. The very first, what really triggers it is when the back of your tongue pushes the whatever it is, your saliva or your food at the back of your mouth. It triggers the whole thing. Now, remember, well, you can basically swallow with your lips open and with your jaw open, but it's a bit difficult right now. It's a bit difficult, but you're usually used with your lips closed and with your jaws closed. Okay, basically that's what you do when you're swallowing food. Okay, so when your lips closed, that's cranial nerve 7. Okay, jaws clenched, cranial nerve what? 5. Very good. Your tongue moves back. What innervates your motor function of your tongue? Cranial nerve 12. Okay, pharyngeal constrictors. Okay, so your soft palate closes over here. See there? Okay, your soft palate closes so that whatever food or drink you have there, it won't go up and out your nose. So sometimes once you're drinking milk or whatever liquid there, somebody makes you laugh and cough, and out goes the milk there in your nose. Your epiglottis closes. Your epiglottis is the one that covers your trachea. Okay, so if it doesn't close, the food might go to your trachea, you might choke, or it might go to your lungs. You will have aspiration pneumonia, which is going to be very, very bad. So basically, swallowing is a life and death function. If your body cannot swallow properly, you stand the risk of choking to death or dying from aspiration pneumonia. That is how well tuned and critical your swallowing reflex is. So, soft palate closes, epiglottis closes, and your esophageal sphincter opens for the food to go into your mouth. That's all 9 and 10. So basically, if you let the patient swallow, so you check cranial nerve 7, cranial nerve 5, cranial nerve 12, 9, and 10. So with that, that's the beauty of reflexes. Okay, let's go to speech. Again, speech is a very, very complicated thing also. Just look at the prerequisites that you need, just the mechanical prerequisites first for you to be able to speak. Number one, you need to have a bellows. You need to have air passing through. So you have your intercostals, okay, to force air out of your lungs, and your diaphragm, okay? You need that to force air from your lungs out, okay? And with that, as the air comes out of the air passages, it passes through your larynx, through your vocal cords. Okay? So that's phonation. The problem is, what if, and that's, well, vocal cords, that's your larynx. And when we're talking about larynx, we're talking about the vagus nerve. So if you have a vagus nerve palsy, you have one side or both sides of your vocal cords paralyzed, what do you have? You have hoarseness. Okay, you sound hoarse. Not horse, but you sound hoarse. Question is, in normal circumstances, can you speak without your vocal cords? Can you speak without your vocal cords? Yes. When you whisper, you don't use your vocal cords. Okay, so whispering doesn't use vocal cords. Now, aside from that, not only do you need air, not only do you need your vocal cords to correctly give that non-hoarse sound, you also have your articulation, where your teeth, your lips, their tongue, they sort of have an intricate ballet to create um, the proper articulation. So sometimes people practice Peter Piper pick whatever. Okay, so that's how it is all well coordinated. And sometimes, many times, everybody has experienced this. Sometimes when you're talking, you bite your tongue. You bite your tongue accidentally. Okay, so that's when something hiccups or misses a beat, and your jaw clamps down on your tongue. So that's basically it. Now, your articulation, that's your palate